This is a demonstration on how to create an individual therapy note for the behavioral health department. First, you choose the encounter for the date you want to create the note. Then you find the template icon on your screen. Choose BH Individual Counseling Psych Prog Note. Click OK, and then find Psychotherapy Individual. Click on that and hit OK, and then you will see the template. You will go down to the section that says Current Assessment. You will identify the individual's progress, indicating either no progress, minimal progress, some progress, or good progress. If you completed a PHQ or a GAD or any other screener, you can add it in this section as well. Then you will go down to individual's condition, and in these open spaces, you will identify the symptoms that you are treating. So the active symptoms under mood affect, thought process orientation, behavior functioning, medical condition, motor activity, and speech. Once you complete that section, then you go down to risk assessment, and you will indicate whether the patient has been having any suicidal ideation um, or homicidal ideation. If they are presenting, you will indicate if it's a which area. You will choose in which area is their risk. If it's suicide, you click suicide, hit OK, and then you will complete the appropriate sections. Um, so one example would be if they're currently suicidal, they're only having ideation with no plan and no intent and no attempt. We'll click add. And then if they're not showing any risk in any other area, you will click that they are not to others or property, and then you click add again, and you can see what you've completed in this section below. So it says that they have suicide risk, but denies property or homicide. So in this section, you will describe what the patient has told you about their suicide risk. So ideation only during times of stress, no plan, and no intent. And then in this section, you will write what the safety management plan is. Always make sure you hit add, or else it will not show in this chart. So then you go to the section Interventions Addressed Today. Here you will write the interventions that you provided during the session. So document the interventions and how they relate to the problem specifically. For example, CBT to help reframe negative, distorted thoughts that kept him from going to job interview. Then in this section, you will write response to interventions. And so in here, you will write how the patient presents in session, be it engaged, responsive, avoiding questions, how they respond to your interventions and their movements towards their goals, and state general evidence, motivation, and compliance with treatment when appropriate, as if they're doing their homework, they're thinking about sessions, etc. The next section, one example would be Patient presented with depressed mood today. Patient was engaged and answered questions asked, reported having difficulties finding work and not feeling motivated to continue searching. Patient was able to practice answering questions to help alleviate anxiety. Then in the next section is plan and additional information. Under plan and additional information, this is where you would write in if you assigned any homework, when the next appointment is, any referrals that you possibly made. Include changes that you will make to the treatment plan if no real progress has been achieved thus far. If patient is under 18 and has ADHD, so example would be follow-up appointment schedule in 1 week. Patient will keep record of negative thoughts and how to modify. In the assessment diagnosis section, you will make sure that the correct diagnosis is displayed in this area. If it is not, this is how you would correct it. You would go to Add Common Assessment, find the correct diagnosis, which in this case is adjustment disorder with anxiety and depressed mood, and you will remove generalized anxiety disorder by clicking on it and then clicking remove. This action will delete selected assessment. Do you want to continue? Yes. Then you hit save and close, and you're left with the correct diagnosis. The next would be signature. So you would click on staff even if you are an intern or volunteer. Then you will go to finalize. You will choose the correct code. So this was psychotherapy, and I met with the patient. It was a 50-minute session, so we'll actually round up and choose psychotherapy 45 minutes. Submit code. Then I will choose a second code, which is a procedure code. If you are a licensed therapist, the code is 303. And then you click add. You will see it says treatment. That means that it's billable. If you are a student or an intern or a volunteer, the code is 305. And it will show non-billable treatment. You will say yes. And you can see that you have submitted both codes for today's date. For unlicensed staff, once you're completed with the procedure codes, you need to go back to the individual progress note, go down to the signature section, and to the right, you will see the tab that says Send Task. You will click on that, and then you will send it to your clinical supervisor. We'll send it to this one, and then you click Add. You'll see the name under the recipient list. You will hit OK. And it will make its way to the inbox of your clinical supervisor where they'll be able to review it and sign off.